Action. Oh, hi, I'm a student nurse.
Hi, how are you doing?
Pretty good, how are you?
I am good. My name is Hanan. I am the nurse on the floor today.
Cool. Do you mind if I follow you around?
Not at all.
Alright.
We have Mr. Rogers here. He is diabetic type 1 and he's got a foot ulcer, so we're taking care of him for that. Well, in the meantime, when he's here, we're taking care of his insulin and maintaining his food, his nutrition. So we're going to go in and administer insulin.
Okay. I have a couple questions for you.
Okay.
About that. Why specifically is this client receiving this medication? What action does the medication have on the body?
He is receiving his medication, insulin, because his sugar is a little higher than normal. We want to bring it back down to a safe level, which is between 70 and 120. The action on the body, what it does is, once the insulin is in the body, it pretty much unlocks the keys for glucose to come in the muscle and fat, which he is not producing insulin anymore. When we give that is pretty much his insulin, and that's what gets the energy into the muscle and fat. It also inhibits the glucose production in the liver. So
Okay.
those are the actions.
When should you question administering this medication? Okay. Does the medication have a therapeutic serum level?
It doesn't have a therapeutic serum level. You should question his medication when if his glucose is too low. You don't want to give it to lower even more. If the patient has any allergy, which he doesn't, he's been taking this for over 20 years. And if he's hypoglycemic, pretty much.
Okay. Which vital signs must be monitored?
We continuously monitor his vitals, but there's not a specific one. We do monitor glucose.
Okay.
But it's before meals and before bedtime.
Which physiological parameters should be monitored when the medication is being administered?
We want to look for hypoglycemia and hyperglycemia. So hypoglycemia signs would be like cold, if the patient is cold and clammy, and hyperglycemia, hyper and hypoglycemia, there will be some loss of consciousness, might get a little lethargic. And for hyperglycemia, let's see, he's gonna get warm, it will increase the urination, get a little uneasy.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
In a hospital setting, we are administering it, so there's not a lot that the patient will do. Because this insulin we're giving is Lispro, is fast acting, rapid acting, we're going to give it before meals. So I made sure that he already ordered his meal and it should be here within 20 minutes. So I'm going to give the medication. By then the food will be here in like 10 minutes, because it will lower his glucose a lot, and if he doesn't eat, then it could be a problem. It could continue to lower. So when he eats, it will maintain a safe level.
Okay. How about if he's taking this at home?
There's more to it when he's taking it at home. So it would be cleaning the site correctly, rotating at a certain spot. For instance, if they like to take it in the abdomen, we would make a grid and go 1, 2, 3, 4, 5, 6, changing locations in the abdomen. And if there's any injury or soreness, they can go under the behind the arm or in the thighs.
Okay.
And just make sure they check their glucose before, make sure it's at a safe level to administer the medication, and follow the prescription's order.
Alright. What are the side effects and potential adverse reactions?
Well, I kind of mentioned it earlier.
Yeah.
It's mostly hypoglycemia and hyperglycemia. You might get it's soreness where he injects it, so just watch for that and kind of avoid that area and move on to the next area until it gets better.
Okay. How will you know the medication is effective?
We checked the blood sugar before. It was 290, so we're going to give the medication, and he's gonna eat, and we're gonna check it again to make sure that it maintains a safe level, which is between 70 and 120, and that's how we know it's effective. If it has come back, the glucose has come back to a safe level.
Okay, that's all the questions I have right now.
All right, so we're gonna get ready to administer. I already looked. We took the glucose 15 minutes, the CBG, about 15 minutes ago. It was 290. And the doctor's order says to administer 6 units of insulin. So we're gonna do that. Let me just draw the insulin first, and then we go there with the insulin and administer and make sure that everything's correct. So I have to pull the medication, and I have Lispro 100 units, and that's what I have here, Lispro. And the order says for glucose between 251 to 300, which is where he is at, it'll be 6 units, so we'll be drawing 6 units. I have an insulin syringe, I have an alcohol swab, and I'll draw it here first, and then we'll go in with the syringe. Oh, first I'll wash my hands. Gloves. These gloves are impossible.
Yeah, they're really tight, but they work. And they're blue.
They're very blue. Very interesting. Okay, so what we'll do, we'll make sure that the expiration date is good, and it is 2020. The medication is how it's supposed to be in a vial, and it's been kept safe, and we're gonna get an alcohol swab, and we're gonna clean the top from the inside to the outside. Make sure it's all clean. And then we're going to draw the insulin. What we do is we pull in about 6 units of air. Here we go. We will inject that air into the vial. And then we're going to pull about 6 units. Here we go.
What are you getting now? All right, so what are we doing?
6 units. Okay. Yeah, we're good. And we're going to recap in. And make it stay here. And we're going to go in.
Okay.
You ready?
Yep.
All right, let's do it. Knock, knock, knock.
Hello.
How are you doing?
I'm doing good.
All right. Let me
Just
let
waiting
my
for
student
food.
come
I just
in over
ordered my
here.
food.
Oh, you did? Okay,
Yes.
good. She should be here any time now.
Good.
All right, my name is Hanan. I'm the nurse on the floor. How are you doing?
I'm good. Yeah.
All right, let me clean my hands here. I have Kevin with me, who's a student here.
Hi.
Hi.
And I just want to make sure that I have your right name and date of birth. Can you tell me your first and last name?
Carl Rogers.
Okay, and date of birth.
He's 67.
67?
62.
Okay. Oh yeah, I got it here.
Good, good.
Do you have any allergies?
I do not. No
Okay, let me check
allergies.
the bracelet. Oh, nice bracelet.
Yeah.
I have insulin for you before your meal.
Okay, good.
It's Lispro. It's a rapid acting insulin. Do you have any questions on that? I know you're administered at home.
I do. Yeah. No real questions about it.
Okay.
Mm-mm.
Well, what is a good site for us to inject the insulin for you?
I usually have been doing it in my stomach.
Okay. Do you rotate it when you do?
I do try to rotate it.
Okay.
Yeah. I'll do it here and then here.
Okay, that's good. Good. Do you know the side effects of this medication? Hypoglycemia,
Yeah,
hyperglycemia?
yeah. Sometimes I will get low blood sugar if I don't eat right away.
Okay. Yeah.
That's about all I've noticed, though.
Okay. Yeah. So for hypoglycemia, you want to make sure that you're, if you have a family member, let's let them know too. It might have some loss of consciousness if you're very sleepy and all that. You know, get cold and clammy, get so sweaty.
Yeah, I kind of know when it's coming on, just because I've had diabetes for so long.
That you do. And then for hyperglycemia, there are some ones too. You feel a little hot. You know, you have to urinate a lot. So those are good signs to look forward. Just to look to see if you have it.
Yeah.
Okay.
Okay.
I have here. I checked, see if that's the right patient. It is the right dose, 6 units, and date of birth is all correct. All right. So I have your insulin here. Let me make sure I can produce it. And I'll be putting in the information once I administer it. So we're going to clean the site.
Okay.
Can you point to me where you want it?
Anywhere, yeah. They did it this side earlier,
so you want it on the other
maybe
side?
over here.
Okay. So we're going to clean the site. And then clean a little poke. Okay.
That did hurt. That was good.
Was it good? Okay. All right, we'll cover it. Do you have any questions for me?
So, no, not really. I mean, no, I don't.
Okay.
I don't.
We have-
They're just checking my labs and everything, right?
Yeah. We checked it earlier. It was 290, so we gave you 6 units of insulin because
it's still
that's
high,
what your
but we'll be working on that. Yeah.
So, and because this insulin is a rapid acting, it lowers your sugar quick. It's the onset of it is like 15 to 30 minutes.
Oh, good.
So,
okay.
So we'll be giving your food soon. It should be here within 10 minutes now.
Good.
And we're gonna make sure your sugar stays in a safe level after that. And then we'll continue to monitor. Yeah. We don't want it to get her too high or too low. Not good.
I know. I've kind of not been controlling it very well. So.
Yeah. That's why we're here to monitor too.
Yeah.
So. Alrighty then. You have your call light. If you need me, just call me.
Okay.
It's right there.
All right. I will.
Somewhere, yeah.
I will. Thank
you. We'll come back here to check her sugar later.
Okay.
How's
sounds
that?
Great.
Okay. You
Sounds
have any
good
questions
to me.
for her?
Thank
good?
you.
Nope. Thanks for letting me watch that.
Alright.
Bye. Good luck,
Bye-bye.
student.
Thanks.
We'll move my glasses.
Alright.
So, how was it?
It was awesome.
Good. How you liked it?
I've got a couple more questions for you. Okay.
I'll put this in the sharps now.
If there were pertinent pieces of information you reviewed before administering the client the medication, what were they?
We looked at his glucose.
Okay.
It was a little higher than what we want, and so that was the main thing. But we do look at everything else, vital signs, to make sure that patient's not going into any distress, but mainly blood sugar.
Okay. Did this information affect your decision to administer the medication?
No. It was, the doctor said 6 units if the sugar is at that level, and that's what we did. So nothing.
All right. Did this information affect how you administered the medication?
No, we administered just how we should have. So we're good.
All right.
You have any more questions?
That's it.
All right.
Thank you.
I'll see you next time.
Bye-bye.